are doing knee skills of the patellofemoral and miscellaneous knee assessment. First, I'm going to do a fusion milking, so please lay on your back. And with this, you're going to squeeze the skin at the knee and the patella, and if they have effusion or swelling, a bubble will appear with an injured knee. Next, I'm doing bilateral patella, and that's when you push down on the kneecap, and if it rises, it shows that there's swelling, and if they have pain, they might have osteochondral defect. Next, I'm doing Q angle. Normal for female is up to 18 degrees, and for males it's 13 to 15. And so I'm lining it up with the ASIS and in line with the femur. And he has about 5 degrees. Next, medial and lateral glide of the patella is you're just moving it back and forth and assessing if there's any difference, and then superior and inferior. If they have excess, that means it could lead to other patellofemoral problems. Patellar alignment includes patella baja and alta, and squinting patellas. So with this, you mark at the top of the patella, the bottom of the patella, and the tibial tubercle. And you measure in millimeters, centimeters. So that's 4.5 centimeters. And that's 5.5. Since the patella is longer than the patellar tendon is longer than the patella, it means he has patella alta. And if the patellar tendon is shorter than the patella, then he has patella baja. Squinting or frog eyes is when the patellas are rotated medially, and it looks like squinting eyes. Finally, doing tibial sulcus angle. Can you sit up on your feet? And with this, anything less than 10 degrees is a normal angle. So with this, you line it up in the middle of the patella, the arm parallel with the table, and the other arm with the tibial tuberosity. And he has about 7 degrees of tibial sulcus angle. That's normal.
I'm going to be doing pole rotations. So the first one I'm going to do is superior and inferior rotation. And I'm going to look from the side. And it looks like the superior is slightly higher than the inferior, and that's bilaterally. The next one I'm going to do is medial lateral tilting. And I'm going to look at both poles, medial and lateral, and it looks like his are medially tilted right there. And then lastly, I'm going to do pole rotation, and it looks like his superior pole rotates inwardly and the inferior rotates outwardly. Next, I'm going to do IT band testing. So, could you lay on your side for me? This one is testing for IT band tightness. It's called the Ober's test. Just slide them just a little bit so you don't fall off. So you want to stabilize at the hip and make sure he is not extended back. He's straight, perpendicular to the table, or parallel to the table. And then you're going to flex the knee slightly and extend it back while maintaining stability at the hip, and then letting it drop behind the other leg. And a positive test would be if the leg were still in the air and didn't drop, but his did, so he does not have IT band tightness. And the next one I'm going to do is Noble compression test, which is for IT band syndrome. Can you lie on your back? Okay. And for with this one, you're going to place one hand on the lateral femoral condyle, and the other one is going to stabilize at the lower leg. You're going to bring the leg up to 30 and 45 degrees, and just flex and extend to recreate the pain or discomfort, and that would be positive for IT band syndrome. The next one I'm going to do is the RENS test, which is exactly like noble compression, except it's weight bearing. So can you stand on to weight bearing? And what I want you to do is do a couple mini squats while I hold on to the lateral femoral condyle. So go ahead. Again, my hand is on the lateral femoral condyle, and if the test is positive, he'll have pain in that area.
Okay, I will be doing plica and other miscellaneous knee assessments. Starting off with the stutter test, you want to place 4 of your fingers on the medial aspect of the patella, just to the side of it, where you will have your patient actively flex and extend the knee, feeling for any clicking or any uncomfortable feelings from the patient. Feel anything with that? I don't feel any sort of clicking, and the patient isn't experiencing any uncomfortable feelings, so the test would be negative for a plica syndrome. Next is medial synovial plica. So you have the patient sitting back. You will bring your leg up. Once again, feel right on the medial aspect of the patella, right in between. Give some slight internal rotation and just passively flex and extend the knee. Again, trying to feel for any sort of clicking and to see if there is any uncomfortable feelings that the patient is experiencing. Once again, I don't feel anything, nothing bothering her. Next, on to palpation assessment. So you can sort of move the patella around to get deep and underneath it, to feel for some plica either on the medial or lateral side. So you can bring it outward, feel in there, and then bring it inward. Feel anything around in there. Okay. Next is meniscus testing. I'm going to start off with Apley's compression. So I'm going to have the patient roll over onto her stomach. You're going to bring the knee up in about 90 degrees of flexion. And on a table, you're going to want to place your hand underneath so that the table doesn't absorb any of the force being pushed downward. So you're going to push the tibia into the joint and give it a rotation. Any pain with that?
Yep.
Negative signs of a meniscus tear. And you can also do a McMurray's, which flip them over. Bringing the leg up, starting with going inward. You can also put a rotation here, going outward and applying a varus force onto the knee joint, stopping there, going back in, another rotation, valgus force there, and then just going up into neutral, another rotation force, and then back down. Any pain with any of that? Good. And now for Thessaly test, you have the patient standing, and they can use table for assistance in this test, as long as they're applying all their weight down onto it. They are starting with one foot, whichever one's injured, for the knee. You are going down, and then in, and then down, and out, and then just straight down, and a rotation back up. And that's the Thessaly test. Next is Wilson's sign for any osteochondral defects. You have them invert the foot, and you'll have them actively extend their knees outward, and if this produces pain towards any of that range, you'll have them bring their foot back out into neutral to relieve the pain, and pain through that, and then relief upon going back to neutral can be a positive sign of any sort of osteochondral problems. And lastly is the Ottawa knee rolls. So to check those, you would palpate for any point tenderness on the fibular head, any isolated tenderness around the patella. You want to check and see if they can actively flex their knee past 90 degrees or even at 90 degrees. And you are also checking to see if they can walk/bear weight within 4 or more steps. And if they can do that, then they pass the Ottawa knee rules.